Sickle cell disease, according to the World Health Organization, is a major genetic disease where the normal round shape of the red blood cells become like crescent moons, leading to blood clots, which can cause extreme pain in the back, chest, hands, and feet. It is caused by mutation in the gene that tells the body to make the iron-rich compound that makes the blood red and enable the red blood cells to carry oxygen from lungs throughout the body. For a baby to be born with sickle cell anemia, both parents must carry a sickle cell gene. It is more prevalent when both parents have the AS blood genotype, which means their baby may have the SS genotype. In sickle cell anemia, the abnormal hemoglobin causes red blood cells to become rigid and sticky. Almost 3% of Nigerians are living with the sickle cell disease. It is considered to be the most common genetic disorder in Nigeria. Testing is not available to a vast majority of the infants with the disorder, leading to thousands of deaths every year. Before this breakthrough, there has been no known cure except stem cell transplant, a procedure which requires a donor, and it is very expensive and carries fatal risk. The disease is prevalent in Nigeria, perhaps more than anywhere in the world. The new drug, crizanlizumab, administered by a transfusion drip, prevents the restriction of blood and oxygen supply, which causes a painful episode of crippling pain known as crisis. According to the National Health Service in the United Kingdom, the treatment aims to help as many as 5,000 people over the next 3 years. Doctors are hoping that the drug can reduce the number of times a sickle cell patient needs to go into emergency care by 2/5. This will mark the first new treatment for the disease in 20 years. However, the rollout of the groundbreaking new drug will be a tentative one, and it will be initially only be made available to around 300 patients, but will be extended to 450 in future years. People aged over 16 who suffer from multiple sickle cell crises every year will be eligible for the treatment, but the drug will not be available for routine use yet due to high uncertainty about the long-term effectiveness of the treatment and its associated cost. Many say that although it is a slow step, it is still a step in the right direction that is long overdue to help persons living with sickle cell disease have a much better quality of life.